drug policy in the last years has exploded, so it's really branching out into other areas of activism that it's sort of been intertwined with. I think the main kind of thing I want to get out from the whole event is that drug issues are not a problem on their own, but are a symptom of greater societal problems. We've structured our society badly, and it's creating people with a lot of pain for many reasons. But in reality, we're fighting the same fight, but from different angles and from different sides. At the end of the day, we're talking about autonomy over your own body, being able to make your own decisions in life, without anyone interfering in that, but also making sure that all the services exist to catch you if you happen to fall. So I wrote this just to give a sum up of drug policy and how it's related to the LGBT community. So drugs, including alcohol, have played a huge cultural and historical role for us. Liberation, celebration, socialization, self-medication, comfort, and sex. Bars have often been our churches and cultural institutions. Drugs have played central roles in our social lives, our sex lives, and our communities. Drugs have been part of how we coped with oppression and hatred, numbing ourselves to handle the homophobia, hatred, and discrimination thrown at us, and how we manage the social stigma and isolation. Drugs have not always been good for us. LGBT individuals have significantly higher vulnerability to problematic substance use. Every study done has shown higher rates of drug use and misuse compared to their heterosexual peers. The reasons cited in the research include less resilience or family support, greater rates of mental health issues, a response to social oppression, targeted advertising, and reliance on bars for socializing. The war on drugs in combination with LGBT invisibility has led to fewer culturally competent resources, services, programs, or therapists for those of us struggling with problematic substance use. Residential programs are structured by gender, with few places for those of us who don't fit binary gender boxes. Many treatment programs are based in religious ideology and are not accepting of LGBT communities. The war on drugs has encouraged police surveillance of LGBT spaces, along with the control of social and sexual behaviours. Drugs or suspected drug use are often used as reasons for increased police surveillance of LGBT spaces, both public and private. The war on drugs exacerbates other oppressions. Low-income LGBT individuals, especially those of colour, are subjected to the injustices of the war on drugs because of their race and class. People of colour are disproportionately punished by the war on drugs, with higher rates of arrest, conviction and imprisonment, despite equal or lower rates of drug use. One reason that gay men of colour have higher rates of HIV infection is because of the intersecting impressions of the war on drugs, racism and homophobia. The previous executive director of the Drug Policy Alliance, Ethan Nadelman, once said, "The movement for drug policy reform stands in the footsteps of other movements for individual freedom and social justice. It currently stands where the gay rights movement stood in the 1970s, or where the civil rights movement stood in the 1950s, or where the women's rights movement stood in the early part of the 20th century. The war on drugs has made the HIV epidemic worse. Substance use is one of the drivers of HIV transmission in our communities." End quote. Whether alcohol, crystal meth, or opiates. The lack of treatment options is directly attributable to the war on drugs and the just say no mentality. It has prevented us from fully implementing one of the most effective HIV prevention methods we know of, access to sterile syringes. Rates of HIV infection among men who have sex with men who also use injection drugs are significantly higher than among other MSM. Transgender individuals who use syringes for hormones and body modifications are also at higher risk. The war on drugs has stopped many of our friends, lovers, and family members with HIV and AIDS from using medical cannabis, although we know that it can help reduce the suffering and improve appetite. The war on drugs has kept us from the information we need to make our drug use safer. Inaccurate drug war propaganda lies about what is and isn't safe, leaving us vulnerable to preventable overdoses, side effects, and dangerous drug interactions. The war on drugs has sent LGBT individuals to prisons and jail for their drug use, punishing them instead of giving them healthcare. It has taken its toll on LGBT sex workers who are vulnerable to drug use, violence, and arrest, especially if they are transgender or people of colour. Incarceration is not healthy for anyone, but prisons and jails are particularly dangerous for LGBT individuals who are disproportionately subject to violence, rape, and discrimination, and for transgender individuals, denial of their very identity. What can I do to end the war on drugs? Come out of the closet about your drug use. Drug war propaganda demonizes and dehumanizes people who use drugs. Let your fellow citizens, your colleagues, your friends and your family know the real face of the Irish drug user. Tell your elected representatives that ending the war on drugs is important to you. Don't let them get away with touting tough on crime measures that don't make our communities any safer, but cost money that could be better spent on health or education. Support politicians who speak out against prohibition, especially our LGBT elected officials. Learn more about the war on drugs and the harm it has caused to individuals, families and communities across the world. You can start at the Drug Policy Alliance website, drugpolicy.org or ssdp.org. Work within the progressive LGBT movement to fight against prohibition and change drug-related policies, laws and attitudes to ensure community safety, liberty and well-being. Support drug policy reform organisations. There are local, state and national groups doing very good, very hard work. So that said, Gerard runs one of the, is the only qualified individual to practice both LGBT and drug harm reduction as one topic. So it's the cutting edge of the LGBT harm reduction movement. So.
I wouldn't say the only qualified. I think there's plenty of people qualified, but the fact of the matter is that there's only funding allocated for one LGBT drug holder post in the entire world. As you mentioned in your speech, can you send me that?
Yeah,
that's really excellent.
Cheers,
that's right. I don't need to do anything now.
So, welcome, Gerard.
Yeah. Guys,